you for joining us. I don't want to be rereading the synopsis of the talk that has already been forwarded to most of the people who are here today. We are here because we share a common interest and concern which we see all around us all the time. According to one of the popular census that was carried out, 1 out of 4 people suffer from mental illness. So that means looking around us, somebody sitting in front of us, behind us, one to the left, one to the right. So out of those 4 people, the chances are one of them is potentially going to be suffering from mental illness. Yet we find this topic to be very much taboo in our community, more so, wherein somehow we feel the stigma attached to this topic. Somehow we feel we should not be talking about this for reasons which are very many. And this is precisely one of the reasons why we have initiated this discussion or a talk on this topic by Dr. Irfan Jahangir, so as to attempt to make sure we shed the taboo that surrounds this very important topic, which is very much a personal problem deserving, which is not a personal problem, but a communal one for which we are all responsible to address. Mental health is thinking about yourself as being difficult or troublesome. The mental health problem is thinking about yourself as being difficult or troublesome. As I said, it is a human experience which deserves a human conversation. So this talk is going to be an attempt to be openly honest so that we are able to restore, recover, and talk about it very openly and make sure we importantly we shed the taboo surrounding this very important topic. So without any further ado, I would like to invite Dr. Irfan Jahangir. As most of you are aware, he's been a very frequent speaker in our circles. This is not the first time we have invited him, but very much pretty much keeping in line with the convention. I'd just like to give a brief background about Dr. Irfan. Dr. Irfan, he was born in Kashmir, which we all know is also popularly known as a paradise on earth. So he's from Srinagar. He's currently based in Airdrie, Scotland, and he has held various responsibilities, including president. He's currently a president and a vice president of a prominent Islamic charity of UK. He's also the chairperson of Islamic Outreach Project. He's currently practicing as a psychiatrist for NHS Lanarkshire. And apart from his profession, which is as a psychiatrist for NHS, he has studied Islam, and he has read the tafsir of the Quran under Sheikh Ahmad Abdul Hafiz Al-Makki for 7 years. So he comes with a very balanced background so that we are able to view this problem both with a very holistic view. So I would like to invite Dr. Irfan Jahangir, please.
Assalamu alaikum wa rahmatullahi wa barakatuhu. I think Brother Malik was about to start as we start the programs with the tilawat, and I think it would be befitting if I request Brother Malik to go ahead with that, and then inshallah I would. But Jazakallah khairan for that, Brother Ghali, inshallah.
Jazakallah khair. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم حاميم تنزيل الكتاب من الله العزيز الحكيم إن في السماوات والأرض لآيات للمؤمنين وفي خلقكم وما يبث من دابة آيات لقوم يوقنون واختلاف الليل والنهار وما أنزل الله من السماء من رزق فأحيا به الأرض بعد موتها وتصريف الرياح آيات لقوم يعقلون تلك آيات الله نتلوها عليك بالحق فبأي حديث بعد الله وآياته يؤمنون. صدق الله العظيم. I've just recited a few ayats from Surah Al-Jathiyah, the beginning ayats. So I'll just read the translation. Hamim. This book is a revelation from the Most Mighty, the Most Wise. Behold, for those who believe, there are signs in the heavens and the earth, and in your own creation, and in the animals which He spreads out over the earth. Too, there are signs for those endowed with sure faith, and in the succession of night and day, and in the provision that Allah sends down from the sky, wherewith He gives life to the earth after it had been lifeless, and in the change of the winds. In all these, there are signs for the people who use reason. These are Allah's signs that we rehearse to you in truth. In what kind of discourse after Allah and His signs will they then believe? Sadaqallahu al-Azim.
Jazakallah khairan. Thank you very much, Brother Malik, as well as Brother Ghazali, for that introduction to the topic. And as you highlighted, this is something which is very, very important. A taboo, unfortunately, people sometimes struggle to even talk about it. And I must say that the scope of my topic, as people must have gauged with the synopsis that's given, that deserves a full day, to be honest, if I am perfectly honest. But I've tried to condense it to give the information which is relevant and which should hopefully help. So we'll go ahead. I have had a bit of a trouble with the slideshow, so I do apologize that it might come up right as a full slide, but I'll try to explain each point in detail. So what does mental health mean? When we say mental health, what does it mean? Because this is where the stigma stems from. Mental health is a part of our health. It is. There's nothing separate from us, because we are ourselves a physical body. We have these hands and head and nose and eyes and ears, and then we have emotions. We have psychological aspects of our life, and we have social well-being. That's your mental health. So the way you think, the way you feel, and the way you act or the way you behave, that's your mental health. That's determined by your mental health. So how you, for example, handle the stress, how you relate to other people, how you make choices, that is what defines your mental health. So mental health is not something that is separate, that somehow comes in out of the blue. It's very much part and parcel of our body, just like our eyes, ears, nose, and other organs are part of us. So mental health is important at every stage of life. So that's whether you are a baby, you're just growing up, you're just learning, you are at the stage of your childhood, adolescence, or adulthood, or elderly. At every stage, just like your physical body is with you, so is your mental health, which is emotional, psychological, and social well-being. So from that, we need to also understand the good mental health. What is good mental health? Because when we know, or if we're able to somehow gauge good mental health, then we could talk about what is missing, or what is a mental health that has fallen ill somehow. So mental health, as I said, is just like physical health. Everybody has it, and we need to take care of it. Good mental health means when you're able to think, feel, and react in the ways that you need and want to live your life. So for example, if you want to have a slim body, so you're going to work accordingly. If you want to have muscles, you're going to work accordingly. If you want to have a certain physique, you are going to work accordingly. So if you want to have a very balanced thinking, if you want to feel good about things, then you would make choices and you make decisions. You will act and react to so many things in the life accordingly. And that's what good mental health is all about. So stresses are going to be there. Life is full of stresses. Life throws things at us. How we are able to imbibe those things, how we're able to take them, then think, feel, and then respond to that. That's what determines the goodness or the wellness, as well as the illness of our mental health. So say, for example, if we are going through a period of a poor mental state, let me call it the mental state or the mental health at that time, you might find the ways in which you are thinking, frequently thinking, not just once or twice, but frequently thinking, frequently feeling or reacting, becoming difficult. sometimes even impossible to cope at certain times. That's when it tells you that this period of time in my life is a part of poor mental health. And this can feel just as bad as physical illness. Just like you are pained, you're having pain, you have a broken arm, which you can see. And that unfortunately makes it better somehow in the eyes of the public. That's where the stigma moves away. If somebody's hand is broken and you can see the cast over it, somehow everybody has a sympathy with them. But if a person is really struggling to cope with this, the stresses and the difficulties that the life has thrown at him or her, and is passing through a rough patch at that time, nobody can see that. So people are not very sympathetic, unfortunately, at that time. So what, how, and why? So what is it, and why does it happen, and how does it happen? These are general questions which people ask all the time. But anyone and everyone over the course of their life can experience mental health problems. It's nothing. It's nothing. Rocket science. Just like anybody can have a urine infection, just like anybody can have a chest infection, just like anybody can have a common cold. Similarly, any one of us, literally any one of us, can experience a mental health problem at any time in our life. No one is immune. We're talking about vaccinations these days. There is no vaccine for mental illness. So your thinking, your mood, your behavior could be affected during such times. It's but natural, very, very natural. Where you're thinking, your mood, your behavior, your actions, your responses, they all get affected during that period because you're passing through a rough patch. Many factors contribute to mental health. They could be biological factors, such as genes or brain chemistry, the way a person is structured, or to use the common terminology, my brain is wired like this. I think like this. I was born like this. But these are factors. Please be careful when we use these words, because these are just contributing factors. They are not like facts where definitely this is the case. These are contributing factors. A person may be more prone to something. That doesn't mean that he has a gene for it. That just means that the person is slightly more prone. And if that combines with life experiences like severe trauma or abuse, then that likelihood becomes a possibility. And then if there's a family history that the person's immediate family members have had this. So a combination of all these factors, your environment, your biology, your brain chemistry, your life experiences, all of these can combine together. And then when they all combine together in a very unhelpful manner, they can be the result of a mental illness that can be looked into, that can be classified, and that can be diagnosed. So far we've been talking about mental wellness and mental unwellness. Then we will talk about the actual mental illness. That's why I mentioned that these all factors can combine to make it a diagnosable problem of mental illness. What does mental wellness do? See, positive mental health allows us to realize our full potential. We're able to cope better with the stressful situations because, let's be very honest, life is full of stresses. Life throws stress at us, just like it throws goodness at us. It does throw challenges. So work productively. So productivity, efficiency is increased if we maintain our mental wellness. And we make meaningful contributions to our communities. Not just contributions in any sense, but meaningful contributions to the communities. These are people of asset. So it's very, very important. Just like if you look at the disability living status, that a person who is physically unwell, how many productive years of life are lost because of that? We should look at how many productive years of life are lost due to mental illness. And in UK alone, there are about 70 million days per year lost of work because of mental ill health. People have to take time off. So am I the only one? This is another question people always think of when they talk about mental. Am I the only one? Is this the experience that I'm having? It's very offsetting, because when a person is experiencing mental illness or mental health problems, it's very, very upsetting, very confusing and frightening, particularly at the first instance. At the beginning, it's really upsetting, especially a person who has been so to say, well, mentally well, throughout their life. They have been a professional, for example. They have worked well, they've done it excellently well, they've achieved well in their life, and then suddenly they face this prospect of depression, anxiety, or any such mental illness, and they suddenly feel like a failure. It's very confusing. Why am I getting this? Why I've never been like that. Very upsetting and very frightening. Am I losing it completely? Am I going the common terminology mad? Will I be locked up? Will I be signed in? So if you become unwell, a person feels that I'm weak now. I'm somehow losing my mind. I'm weak. I'm no longer good enough for anything. So these fears again are reinforced by the unrealistic way that people experience mental health problems. They think about them because there is a picture painted about them on TV shows and films and media. And when that picture is in front of them, it's like a person running with a knife and wanting to kill everybody. And those kinds of absolutely false and unrealistic viewpoints, they reinforce this fear, this frightening, confusing, upsetting situation. So this may stop you from talking about your problems. Fundamental thing, because if you don't want to be seen like a mad person, you don't want to seek help about it, and this will further increase your distress. And more importantly, it will increase your sense of isolation. You'll feel nobody's listening to me, nobody wants to listen, nobody wants to hear about it. However, in reality, as was pointed out earlier on, 1 in 4 people experience mental health problems in a given year. It's a massive amount. It's not so. Every fourth person you're looking at has the potential of being 1 in 4 experience problems. Sadness, stress, worry, anxiety. So you're definitely, most definitely not alone in this. So I share some patient experiences. One of the patients mentions, it wasn't until I had a breakdown that I felt my condition was serious enough to qualify as an issue. It was really a breakdown because he or she kept postponing it, procrastinating about it. I could have got help much earlier. But I didn't because of this, because of feeling that, it will be fine. It's never too early to seek advice. Very, very important. When you find that there is issues with your backache, you go straight away, try to find some solutions. Similarly, when you know the mental health is wavering, is not doing good, definitely seek advice. So different types of mental health. What do we mean by that? There are different mental health problems, basically. Sometimes it's grouped under one big, paradigm or one big umbrella, and people think, oh, that's it, and everybody is like the same. That's not the case. Some have similar symptoms sometimes, and that also becomes confusing, and people think that everybody is the same. But you may experience more symptoms or less symptoms, or you might have different combinations of symptoms. The most common combination being anxiety and depression. They usually are present, in the same individual. When the person has anxiety, they usually end up having depression as well, but not necessarily. So don't be worried or frightened straight away by not knowing about it. So the best way forward is to know about it. So you get a particular diagnosis, you find what the difficulties are, and everyone's experience is different in this case. You'll never have two people saying exactly the same things, although there would be similarities. So what causes mental illness? What are the areas? Do we know anything? Yes. A lot of the things have been, there's a massive amount of research that is available today with us. And we know for sure that abuse, especially childhood abuse, trauma or neglect, they are huge contributors to causing mental illness. Social isolation, loneliness. And loneliness doesn't just mean somebody is living alone, although that's a huge part of it. Loneliness means when you feel not supported in your own families as well. Like coercion in couples, females or males, they are abused in the house. They are isolated from the whole family, and their partner doesn't allow them to have a coercive control over them. That creates isolation. That creates loneliness. Experiencing discrimination and stigma, huge parts. When you try to do everything you want to do, and you are trying your best, but then you are up against discrimination and stigma in the society, be it on any basis, you're fighting a losing battle really. Socially disadvantaged, poverty, debt, bereavements, when you lose somebody really close to you, somebody you're dependent on, that's a massive, incident in one's life, severe or long-term stressful situations. As I said, stress is part and parcel of life. So we need to deal with that. But if there is severe trauma, severe stress, and long-term, which is not going away, that can lead to mental illness. Having a long-term physical health condition, for example, a person is not able to move around, a person with severe conditions which cause a huge amount of difficulty, that can impact on mental health. So a person has physical health difficulties. On top of that, the person is now struggling from a mental health perspective. A lot of the people with physical health or physical health difficulties and disabilities unfortunately commit suicide. And the reason for that is because they have had the impact on the mental illness, which sometimes may not have been picked up. So, unemployment, losing your job, homelessness, poor housing, all these areas which cause disadvantage, which cause a person to have less of capabilities, they are huge risk factors for causing mental illness. So, being a long-term carer for someone, don't get any, you don't get any relaxation. You're frustrated by looking after somebody. A huge part, and there will come a breaking point. Drugs and alcohol misuse, massive part, unfortunately, especially in our part of the world. Domestic violence, as I was saying earlier on, bullying, coercive control, abuse as a result, a significant trauma like military combat, being involved in a serious incident, very serious incident that you were faced with the fear of life, or being a victim of a violent crime. Physical causes, head injuries, sometimes the neurological causes, epilepsy, and the list just goes on and on. But it's important to rule out the physical causes before you seek further treatment for mental health problems. A lot of the times, physical health problems are the cause of all these difficulties, and once the physical health problems are looked into, they are dealt with, then your mental health automatically improves. The other part of my topic today was social norms and mental health. Well, what do we mean by social norms? Social norms vary from one society to another society. And even in one society, there are subcultures, subgroups. Like in UK, we have almost people from almost every culture in the world living in the UK. So you would find that subculture, and that subculture will have its own norms and societal taboos, what they do, what they don't do, what they like, what they do not like. And so the pressures to conform to that society, even to that subgroup of society, following a traditional path, as it is known, without any discussion or questioning, it can lead to increased stress, at times frustrations, negative reactions, and can even lead to depression and anxiety if that continues to be the case. So it can have a detrimental impact on one's mental health. So allowing individual self-determination, the ability to decide what they want to do in their life is a huge part. It's a massive positive. People have to create an environment of reasoning, discussion, healthy debates on all aspects of life, and they will bring about positive changes. See, forcing ideas, even faith or any behavior, is neither sanctioned by God nor does it lead to any benefit in the long term. It has to be, decided by the individual. It has to be thought out by the individual. That's when it carries really weight and benefit. And the same is true at the family unit level. And when you're having a family system, in that family, everybody needs to have their voice. You need to listen to one another, and you need to be able to discuss and debate things and then come to positive conclusions. A study on the social norms has mentioned that the social norms play a huge role in our decision making. Using brain imaging data, the researchers have built up the ideas that the notion now is that social norms influence decisions more than a desire for fairness, which is unfortunately very sad. That the research suggested that when faced with a tough, possibly ethically laden choice, we are more likely to do what we think society wants us to do instead of what we feel in our hearts is fair and morally right. This unfortunately is another case, but we need to be able to be tough enough and strong enough to resist that. So research also suggests that some mental health problems run in families. For example, if you have a parent with schizophrenia, there is a higher chance, but again, this shouldn't be taken as that somebody in the family has mental illness, and so you're automatically going to get it. And nobody knows whether it's due to genes or because of other factors which we talked about. There is environment, there is genes, and there is the experience of the individual, all three combining together to forming how they think, how they cope, and how they behave. So although the development of some mental health problems may be influenced by our genes, but there isn't any specific genes that you are looking for mental illness. There isn't anyone, thankfully. And many people who experience a mental health problem don't have parents, children, or other relatives with the same condition. So that's again a positive in the fact that it's not run in families as people think, somebody has in the family, so automatically the other person will have. Most common mental health issues is the other part of my topic today in the Muslim community. That's what I'm focusing on today, the Muslim community. There is a dearth of data in this area, unfortunately. Not much research has been done. Two reasons. Number one, Muslim communities as a whole do not come forward to do more research on them or to be open to do research. And number two, there isn't much interest even in the research or the scientific world to actually look at it. Although there are almost 1.7 billion Muslims in the world, and I think that should be looked into, but both ways. Neither is the science interested, nor is the community interested. So both have to come forward to achieve this. I have this data, this is based in America, South Asian ethnicity, and this can be extended, applicable to UK because we see the similar trend in UK as well. So in this Hamdard Center for Health and Human Services in Chicago, 875 clients were researched based on what are the most common mental health issues among Muslim communities. And because the South Asian ethnicity as well as the Middle Eastern and some Bosnian ethnic backgrounds over there, these are the similar kind of ethnicities that we have in UK as well. So here is your list, what they found. So adjustment disorder, they found the most common one, 43%. Adjustment disorder is a disorder where a person struggles to come to terms with what is happening. Like, for example, people have migrated to the West and they're still not able to settle well over there. Or people have been married to a partner and they are not happy with that partner. But because of social norms, they don't want to leave, but at the same time are not happy with them, are not able to adjust. There are so many areas. Adjustment disorder is any sort of adjustment. It could be simplest form of job. You're not happy with your job to the fact that you're not happy with your life at all in certain aspects. So adjustment disorder is a very, very kind of wider ranging area. Then the next one is anxiety and obsessive and compulsive disorder. Again, very important. Something really, really important to understand. Obsessive and compulsive disorder. And it's particularly important in the Muslim community because in all religious communities, OCD or obsessive compulsive disorder comes with a flavor of religion, if you like, flavor of purity. And I'll try and explain that as well. So OCD is a common mental health condition where a person has obsessional thoughts and compulsive behaviors. That's what makes two parts, obsessions and compulsions. Obsessions are thoughts in the mind, and compulsions are the actions that the person does. And these are very unwelcome thoughts, religious thoughts. People sometimes get thoughts like wanting to swear at Prophet Muhammad, peace be upon him, or wanting to hate God or hate the Quran, or things very, very distressing, extremely unwelcome, extremely distressing thoughts, images, urges, worries, or doubts that they repeatedly appear in their mind, and they are very distressing, very anxious. So they have to do the compulsory behaviors, repetitive actions like washing the hands so many times, checking the door so many times, reading and closing and opening and closing the Quran so many times, and so many other things that can be related to each and every individual. Or they sometimes have to say a particular phrase in their own mind repeatedly before they feel a bit more relaxation. So this obsessional thought causes a huge amount of distress, and this compulsory behavior or activity releases those unpleasant channels, and so the person feels a bit more relaxed until the thought comes again. So I'll deal with the Islamic perspective of overall mental health in the end, but I thought it more appropriate to deal with the OCD part over here since it's been mentioned. So the OCD, or the unwanted thoughts, are called waswasa, and wasawis is the plural of that from an Islamic perspective. The Quran has mentioned this, that the shaitan whispers suggestions to Adam and Eve and how they were, innocent about their private parts, and then they suddenly came to know what the private parts are all about. And that's how he was the one who whispered to them. And the Quran also mentions that, he whispers, shayateen whisper evil thoughts into the minds of the people, and we have been asked to seek refuge with God. Say, I seek refuge with God, the Lord of mankind, the King of the mankind, the God of mankind, from the evil of the whisperers of the devil, who whispers in the hearts of men, and they could be from the jinn or the men as well. So shaitan, Prophet peace mentioned that he comes to you and says, who created so and so, until he says, who created your God? So when he whispers such a question, one should seek refuge with God and give up such also repetitive thoughts. There is a kind of a subtle mention in this verse, in this hadith of Prophet, that these severe wasawas, these severe kind of religious thoughts which are very distressing, are basically from shaitan. And he also mentioned that all human beings experience at some point in their life that, regardless of what age group they are. So the nature, content, severity, and the influence of these wasawas, or these inspirations, or these negative thoughts, they vary from one individual to another individual. However, they can affect a person severely, becoming spiritually, mentally, emotionally, psychologically, and socially incapacitated, because it can be terrifying. A person who is a believer suddenly has a thought which goes in complete opposition to what his belief is. He's respecting something, and the thought is extremely terrible. He's not even able to sometimes say what he's thinking, or what the word is coming to his or her mind. So the Quran has mentioned about it that, when you intend to recite the Quran, seek refuge with God from shaitan, the outcast. Verily, he has no power over those who believe strongly and put their trust only in God. His power is over those who obey and follow him, and those who join partners with God. So again, the treatment continues, and deceive among them whom you can or want with your voice. Verily, only on my true servants you would have no authority. So this is a huge, relief for people that, God is the guardian of those people. Moreover, it's also mentioned that God Most High has forgiven the wasawas that arise in the hearts of the people of my nation until one acts upon them. So this is something very important, again mentioned in the hadith, that these thoughts will come to the mind, and shaitan may put them into mind, but God has forgiven them. So the person is relieved of this burden, that why am I getting these thoughts? There's a clear-cut indication that, you will not be held responsible for thoughts. We'll only be held responsible for our actions. So that was about a brief note about the OCD part of it. Continuing with the overall mental health issues, there are two important neurotransmitters, or the chemicals in the brain, that get released, which are hugely important. One is called dopamine, and the other one is called serotonin. Dopamine is linked with pleasure, and serotonin is linked with happiness and satisfaction. And it's amazing that dopamine gets released when we take something, or when we gain something, or when we are engaged in some pleasurable activity. Whereas serotonin gets released when we give others, when we help others. So you can see that the key to happiness and satisfaction is giving, and pleasure and engaging in pleasurable activity is only for an individual. That may not give you satisfaction, that will only give you pleasure. I also wanted to share this scan with yourselves. The brain scans have shown that there are certain areas of the brain which are affected in people who have mental illness. And two important areas are the parietal part of the brain and the temporal part of the brain. Again, I don't want it to become too scientific. So what I've mentioned is I'm going to just let you know what these parts of the brain actually do, so that we can form an image as to how it affects us. So the parietal lobe, which is on your right and left hand sides, whole part of the lateral side of your brain, it figures out the messages we receive from five senses of sight, touch, smell, hearing, and taste. So this part of the brain tells us what is part of the body and what is part of the outside world. It gives a sense of me, who I am. Yeah, and the temporal lobe, which is just behind your ears, that recognizes the sound messages. It also recognizes the speech. So this is how we understand what people are saying. It also helps with smell and memory as well. So we're looking at knowing who I am, how I am different from the rest of the world, hearing, noise, and all those things. So yeah, the two most important parts, days in your life, are the day when you were born, because obviously that's The most important day, isn't it? And the day you find out why. Why were you born? What is the purpose of your life? Psychotic illness, again, two important aspects of today's discussion is schizophrenia and paranoia. Schizophrenia is a psychotic illness. Psychotic illness means when a person is experiencing symptoms. Now imagine this parietal lobe, when I said to you, you're able to make sense of what is outside, what is inside, what is real, what is not real. Imagine if a person is not able to do that. If all of this is hazy, you're not able to make sense of what you are saying, what others are saying, what you are saying, what you are experiencing in touch and other things. It's all disorganized thinking and speech, disorganized senses, and all these senses are affected. You can see the person will be finding difficulty concentrating. He's disconnected from your feelings, disorganized thinking, hallucinations, delusions, thinking of things which are not there, seeing things, hearing things which are not there, lack of interest in things, not wanting to look after themselves because they're lost in their own world. That's what psychotic illness or schizophrenia really is. Paranoia is a form of delusion. It's a form of thinking where a person feels threatened all the time without there being any evidence to it. But this person, regardless of how you perceive things, regardless of how you present the evidence to them, they exaggerate these thoughts. They are extremely suspicious. For them, these are real things. They are believing that they are being persecuted. Somebody is following them, and they are directing the hate campaign against them. And so, what is a delusion? So we need to clarify the paradigm. Delusion is a fixed belief, which is clearly false, and it indicates an abnormality in a person's thought. Again, the thought processes have been jumbled. They're not in their right form. This belief, this false belief, is not accounted for by a person's cultural or religious background. For example, people from the Muslim background believe in the Jinn, because the Jinn is reality. The Quran mentions that the Jinn are a form of a creation of God Almighty. But although there's a whole mumbo jumbo of how jinns interact, what jinns become, which we'll talk about in a minute, but this is a cultural belief. Just because a person believes that jinns are speaking to him, or he can hear jinns, or jinns can come to them, doesn't mean he or she is psychotic, because that's within the culture, it's in the purview of the culture of that person. Or also the level of intelligence of that person also matters when you're talking about a false belief. The key features are these are unshakable beliefs, unshakable, irrespective of the evidence that you present to this individual. He or she is convinced that this is a fact, regardless of what evidence you present to them. Another aspect is bipolar disorder, where people have two extremes of either mania, where they think they're very high, they feel they're the top of the world. Sometimes people think they're God, they've got all the powers, they're superpowers. And the other extreme is they're extremely low, extremely depressed, can't be bothered to even move from their couch, and having some psychotic symptoms. So these are some of the very common mental health issues. So let me look at the Islamic perspective now. And I am aware of the time, and I'm also aware of the fact that you will be noting down your questions. Please do keep them, and I will, inshallah, try to answer them. So now, Islamic perspective of mental health. So what's the Islamic perspective? Islamic perspective is the straightforward perspective. It's important to understand that when we, as Muslims, face some major life crisis, there is an increase in religious practice. It's often seen as the only choice. Somebody has hit something bad, and straight away Salah, straight away Quran, straight away Masjid, straight away Zikr. And psychotherapy is not seen as something which is positive. However, personal relationships would continuously provoke and surface a person's insecurities, which make you realize that no matter how much you increase your ritual Islamic practices, it is not going to resolve or improve your deeply rooted psychological problems. We are trying to find solutions of psychological problems, illnesses, in something which is spiritual. And this is called spiritual bypassing, which means you are unconsciously using Islamic practices to avoid or bypass your pathological psychological issues and emotional unfinished business. So that needs to be solved. It's like, for example, if somebody has diabetes and he suddenly starts reading more Quran, diabetes is not going to go away. Yes, you'll feel a bit more comfort. You'll get that spiritual food, alhamdulillah. Quran is for a spiritual food. but it's not for the treatment of your mental illness or your physical illness. You have to treat your mental illness just like you'll treat your physical illness, not by reading Quran, but you can supplement it by reading Quran, but first you treat the illness. So this is, I'm telling you about the spiritual bypass of one of the patients. This is a lady, she says, I did exactly this. When my engagement was broken off, I turned to God to feel better and to heal my broken heart. For a short time, it helped. However, as the years went by, I found myself closed off from the thought of another relationship. Friends and family would try to introduce me to other marriage prospects, and I found it hard to open up to them. I was guarded and standoffish. I found it much easier to delve deep into my ritual practices, such as praying more, reading the Quran, performing more frequent zikr. Deep down, I knew I had issues I needed to confront, but I was completely unaware of what to do about it. So I just numbed my issues by ignoring them and increased my religious practices to temporarily find some internal peace. Eventually, I became more and more unhappy. I did not like the person I was becoming and started reading self-help books to understand myself. So three important bypasses you'll find in Muslim community. They do spiritual bypasses in three different ways. Number one, the good servant. This type of person is someone who spends an extensive amount of time and energy volunteering, participating in spiritual events and activities, while close intimate relationships often are neglected and suffer. This person tends to exhibit traits of compulsive goodness, that I have to do goodness compulsively, whereas he's ignoring what's happened, what is happening, and how he has to deal and face those difficulties which he has struggled with. Second one is turn the other cheek. This type of person does not confront or deal with his or her negative feelings, such as anger, for example. Instead, he or she will likely swallow his or her anger, which is something that he or she probably has learned early in their life. Often these individuals are known to be, acquiescent and become passive aggressive. And that's a terrible thing to become. When you're passive aggressive, it's even worse than being openly angry at somebody. Third type of bypassing is I have a gift. This type of an individual believes that he or she has God-given talents. Such a person also believes that he or she does not exhibit any inappropriate behavior, does not need training to increase his or her healthy spiritual practices. So they just keep on doing the ritual things and bypass the difficulties that they initially were faced with, due to which they started channeling these into spiritual ritualism. So confront your fears. It is very important that therapists become aware of this phenomenon. Even when the therapist is involved, he or she has to know about these bypasses that the person is trying to use and help their clients make the connection of how spirituality and psychology can work together in a healthier manner, but not on their own. If someone is engaged in ritual practices and still feels unhappy or dissatisfied with his or her life, then a helpful starting point is to examine their personal relationships to become more self-aware. What kind of relationships am I? How am I seen by other people? So how can this be done? This simply being asking themselves some key questions. What are the questions that we need to ask? What issues do I struggle with in my relationships? What does my spouse say about me? What does my parents say about me? What does my brother and sister say about me? Why do I become angry so quickly? What is it? Find an answer to this question. Or why do I stay quiet about things that hurt me? Why do I not become angry? A genuine question again. Do I tend to make a big deal over small things? Do I get anxious or worried that my partner is going to leave me? Am I really very, very insecure deep down? How do I deal with things when I am upset? Do I just leave them? Do I get angry? What do I do? Do I withdraw? Why do I ignore my feelings and just forgive the person to keep the peace? Why do I do that? That may be a good strategy, but you have to ask this question. Why do I do that? Am I just turning the leaf and keeping it away? Or am I really genuinely doing a good thing? The role of a Muslim therapist. Now, historically, therapy did not integrate spirituality as part of the healing process. This is very unfortunate because the modern psychotherapy, the modern psychology has all come from the Western world. And they, regardless of however unbiased you might think, it automatically becomes biased because you are dealing with people who are therapists from a particular background, and they are dealing with a society that has a particular norm, particular understanding, particular social setup, particular beliefs or no beliefs. All those systems are in place, and they have that bias, unfortunately, that even percolates into the therapies. Unless and until we incorporate therapies knowing more ethnicities in the world, we will not be able to actually produce a better result for other communities. So, the growing practice of incorporating spirituality in therapy presents both opportunities for better healing and potential threats of helping clients bypass psychological issues. This is an important aspect to know. So, therapists' role is instrumental in the healing process, and mental health professionals have the ability to develop secure attachment bonds with clients, helping clients open up and tackle difficult emotions which are repressed in their unconscious mind. Yeah. Clients advance in their spiritual practices may attempt to bypass emotional discomforts and prefer to work at the spiritual level. One key thing a therapist can do for them is to make them examine close relationships and notice any unhealthy or destructive patterns. So they have to be responsible for, rather than continuing to blame others, they have to take personal responsibility by gaining insight and assuming that responsibility. So the comprehension of spiritual bypassing may assist in inspiring more developmental growth, especially after a relationship problem, breakup, divorce, or other types of life crises. It's very important that people do not use this as a crutch and bypass the issues which are really, really important. However, there's an important clarification which I want people to focus on. Turning to religion is culturally conditioned and necessary at the time of crisis for emotional stabilization for a Muslim or any believer or any faith at that time, anyway. Spiritual bypassing is not necessarily a bad thing. Don't get me wrong, it's not a bad thing. I'm not saying it's a bad thing. Increasing one's religious practices may, on one hand, be a destructive defense mechanism, or it can be a detour from the pain, but rather an essential part of the emotional grieving process. So when a person is grieving, it will help that grieving. So it's not a wrong thing, but do not just leave it there. You have to confront your fears. You have to confront the real problem. Not being able to turn to religion would have most likely created additional internal chaos and disarray in an individual. That's fine, you do that, but do not forget that the problem is somewhere else. Excuse me. We know the John Bowlby's theory of attachment, how important that is in psychological aspects. So what Islam does, it provides that healthy attachment, the most strongest of bonds, the most strongest of attachments to God Almighty, the all-powerful, the all-knowledgeable, the all-inspiring God. And that provides a strong, unflinching, never-wavering attachment for an individual. As the Quran says in 65:2-3, and for those who are mindful of God, He always provides a way out, and He provides for them from sources they could never have imagined. And whoever puts their trust in God, then He alone will suffice them. Certainly God achieves His will. God has set a measure for everything. So having that secure bond with God, an attachment, is one of the brilliant things that can improve a person's coping mechanism, well-being, self-esteem, and help strong relationship. So after that clarification, I must emphasize that bypassing is not going to help you. Spiritual bypassing won't help you with your mental health difficulties. At the time of crisis, a person may need to turn to religious practice. However, eventually it's important that you have to heal yourself. Bypassing is not going to help. I'll give you another example. As I said, a picture is worth 10,000 words. S is a 40-year-old Muslim woman. She has been married for 15 years and has 3 children. She's a professional and considers herself a devout Muslim, wears hijab, and is actively involved in the local Islamic community. 4 years ago, she shockingly discovered that her husband had an affair. This stripped her of all sense of security, triggering a number of issues that she had suppressed over the year and had justified through her interpretation of what is meant to be a good Muslim wife. She found herself acting impulsively and destructively, setting her husband's clothes on fire, crashing his car, crying hysterically, and lashing out repeatedly at her husband and children. She no longer recognizes herself and knew that her behavior went against her beliefs. She experienced a roller coaster of emotions. She says, I felt like a crazy person. One minute I am rationalizing to myself that this happened by the will of Allah and that I need to accept it, but the next minute I'm crying because I can't believe He did this to me. I was a mess. I cried a lot, isolated myself from the community, and just tried to pray more. So S consistently participated in therapy for almost a year, which helped her make the connection with how the ritual practices of her faith had helped her to avoid or bypass her psychological pain. This is spiritual bypassing. For many individuals, there is confusion between the role of religion and psychology. Most people are taught that if his or her faith is strong, then he or she would not engage in negative behavior. A big lie. We're all humans. Faith or no faith, we're all humans. In S's case, therapy helped her recognize that avoiding her psychological issues was only hindering her from practicing her Islamic values in a healthy manner. And that is what needs to be understood. So I'll give you the beautiful summary that S has given for all of us to learn. Therapy was not what I expected. I felt safe to talk to someone who wouldn't judge me and help me make sense of what I was going through. The most important thing I learned is to honor my feelings, especially my negative ones. I also became aware of my insecurities that allowed me to ignore all the warning signs. I kept putting up my husband's negative behavior because I believed Islam tells you to not argue and make the home a peaceful place. I thought this would help save my marriage, but I learned not honoring myself or my rights was just helping my husband to dishonor me more. I had to learn to honor myself so he could honor me. In the past, whenever something bothered me, I would usually talk myself out of it or pretend it didn't bother me. Therapy made me aware that my devastation from the affair brought to surface all those things that I had ignored or stayed quiet about for years. I become more aware, self-aware of my insecurities and learned to express my needs. A lot of the times, one big incident is actually just bringing to surface years and years of repression and mental health issues, problems which have been, just bottled up for so long. So, role of family. Family is an important socio-cultural component as it is the unit of the society. It has a huge impact on personality development, and Bowlby again presented a permanent loss of parent as a huge vulnerability for psychopathology, including depression, as a cause. And Karen Horney, again, these are the psychologists I'm talking about, talked about, greed were not inevitable phases of humans' development, but the expression of a neurotic process. So by helping individuals to grow up under favorable conditions, they could develop and lead a healthy life and realize their potentials. Islam enforces the family role in Muslims' life and hugely emphasizes the religious, moral, and ethical values, especially in relation to relationships. Western society, unfortunately, lacks the fundamental tool. Is currently, witnessing broken families, as our ex-Prime Minister David Cameron rightly put it, that we are a society of broken families, sadly. Drug abuse, excessive sexual activities are predominant in adolescents and young adults with no positive role models whilst growing up. These events lead to conflict, loneliness, guilt, loss of self-esteem, which results in the manifestation of various psychological disorders. So, again, as I mentioned, there's a huge part that plays is the family. And if there is no family support, it's very, very hard. Psychiatrists and social workers need to consider the impact of families' involvement on individual mental health, which may be a double-edged sword, though. On one hand, it may be helpful as a family may help in supporting the patients regarding the medication and psychotherapy, which helps improve. However, on the other hand, different families with over-involvement and enmeshed patterns can be difficult to deal with. And I tell you from personal experience, in some cases, the family will interfere on behalf of the identified patient, although they too lack in trust, whereas they expect much. They might try to control the interview by answering the questions on behalf of the patient, while they withhold information and may be perceived as embarrassing. That information which may be perceived as embarrassing, they will withhold that from you. They may interfere with his medications and choice of treatments. So just to mention, sorry, I just need to put this on, otherwise the battery is running out. Sorry, my apologies. So I'm just trying to mention that they might try to control the interview, and this is a double-edged sword. On one end, you want people to be a part and parcel of the individual's help and support, but on the other end, you don't want them to interfere too much. So it's a double-edged sword in that sense. Parenting and mental health, the transition to parenthood may be difficult. Parents and children or young people often feel isolated and unsupported when their parents are unwell. So that increases distress in the family. Large number of children who grow up in situations where parents have psychological issues have a lot of difficulties. About 50 to 60% of parents with a severe and enduring mental illness live with one or more children under 18 in UK, which is about 17,000 children in UK alone. Jinn possession, this is the last bit today, inshallah, and I am very conscious of the time. Among Muslim patients, a common cultural notion is that jinn may be the cause of mental illness or mental problems, especially in the presence of hallucinations and conversion disorder. I'll try to explain that. So from the 551 patients that were screened on this particular aspect, 118 were eligible for participation. So about 43% of them were positive that their psychiatric symptoms were caused by jinn. They were positive. No, there's definitely jinn. You're talking about medicine. I don't need any medicine. This is jinn. 27% thought that no, it's not jinn. And 31% were saying we're in doubt. It could be jinn, it could be something else. So you have 70% almost 73% of population saying jinn is a part of my mental illness. And these are people who have been diagnosed with mental illness. Those are the type of people I'm talking about. So 87% had experienced hallucinations in their lives. So they had seen something, they had heard something, and some sort of a hallucination was there, and yet they believed it was the jinn that they had seen all of these. And 58% of the original 551 did not want to participate. Why? Because they had the fear that if they said something about it, if they even spoke about their repercussions, they would face from jinn. The jinn would trouble them. So even those believed that it was the jinn, and if they spoke about this to a psychiatrist or to a health professional, the jinn would harm them in some way. Right, so symptoms that are usually linked with jinn possession are, when exploring the symptoms among these 551 patients that I've mentioned in this huge study, anxiety, obsessive compulsive symptoms, OCD, which we discussed earlier on, aggression, attacks and nightmares, physical pain, sadness, suicidal thoughts, weakening of the legs, headaches, insomnia, bloating, flashbacks of traumatic events, incubus phenomena, sensed presence, and hallucinations. These were the symptoms which were identified in those patients. So these are all mental health issues. The incubus phenomena is a paroxysmal sleep-related disorder, which is characterized by compound hallucinations. A person experiences as if somebody is throttling him or her. On the throat, it's as if there's a presence of a kind of a male who's throttling, and it's also associated with carrying out aggressive or sexual acts on the individual. It's a very much well-known phenomena. It's between sleep and wakefulness, kind of this time when the person feels like that, and its relevance is huge, but people see that as jinn on their throat. An equally remarkable finding in this study was also that the people who experienced more modalities of hallucinations, like for example, a person who saw something and heard something, they were far more sure that it is jinn than the person who had only heard or who had only seen something. If a person had one modality, they would say that's probably mental illness. But if they had more modalities of hallucinations, they would say it's definitely jinn, probably because they think it's more real when it's all modalities. Although the reality is that it's the opposite. It's the opposite direction. This is the verse of the Quran, 102, Surah 2, which is usually misunderstood about the Prophet Solomon, and the knowledge that was given to the two angels during the captivity of the Jews in Babylon, and how that they taught some special knowledge, and that knowledge has come down the way. We don't have the time to discuss this time. Inshallah, when we do our next topic on this, we will discuss this. So conversion disorder, as I was trying to say about the jinns, conversion disorder is a mental condition in which a person can become blind, paralyzed, or nervous system symptoms, not real, but they feel like the person is gone blind. And these are not unreal ones, or they're not feigning. People at risk of these could have a mental illness, a dissociative disorder, where the person wants to escape from reality. That's not on purpose, though. A personality disorder, a person may have these conversion disorders. So the physical symptoms are thought when they're not resolving, people go into a conflicting state of their mind, a subconscious, and they can do things, say things, or become numb or act in a different manner. Similarly, dissociation is a part and parcel of that, where they can sometimes speak in different languages. They have huge, powerful control over things, but these psychological factors, such as stress or conflict, they are associated with the appearance of the physical symptoms which take over. So marital life, I've discussed this before, that, well, believe it or not, that married men and women, compared to their single counterparts, enjoy better health and longer life. This has been the study, so I don't know how many people will agree with that, but it's a very robust, believe it's a very robust study. Being married typically is expected to lead to greater availability of emotion, social support, meaning and purpose in life, and social control, which are concerned key processes that promote physical wellness. So there you go. So negative verbal and non-verbal exchanges can lead to marital problems. Poor marital quality is associated with negative physical health outcomes, as well as low self-rated health, as well as mental health. So increase in depression and functional impairability due to marital conflict, indirectly lead to a rise in depression via functional impairment. Overall findings suggest that marital conflict is a significant risk factor for physical as well as psychological issues in older adults. There you go. It was a marathon, and I have tried my best, believe me, to just run through the whole topics. Any question? This is your wheel of well-being. Learn and development, good nutrition, rest, chill out. Relationships, have real positive relationships, mind and spirituality, but without spiritual bypassing, and exercise, which is important for all of us. Any questions? Thank you very much, everybody.